Okay, it all started end of 2023 when I did a health screening. And from the health screening, I noticed that there was a microscopic amount of blood in my urine. So from there onwards, then I went to see the urologist. And urologist did a ultra scan on my kidney and found that there was actually a tumor on the right side of my kidney. Yeah, so that has to be operated and taken out. So that's what I did. First oncologist that I saw, he told me that there's nothing that you can do, just monitor. Yeah. So I didn't want to just be passive and just sit back. I know that cancer is not something to joke around. Yeah. So that's where I actually decided to look for alternative source of treatment to boost my immunity and to actually improve my health. So that's where I come across Dr. Lee in KL. Yeah. Personally, I believe in holistic treatment rather than treatment through drugs and the traditional form of treatment for cancer. Because I've got experience of past loved ones which didn't work out well when they went through the traditional route of cancer treatment. Yeah, I mean, I wasn't hesitant at all because I was doing research on my own. What are the ways to actually tackle cancer? And I came across a lot of successful incidents of people doing well through alternative form of cancer treatments like metabolic treatments, treating cancer as a metabolic disease and through nutrition and detoxification. So that's why I thought that this is something that I should try out. Give your body a chance to repair itself. If you can supply the body with the right source of nutrition and raw materials, it's likely that your body will actually heal itself and take care of itself. If a patient still wants to go through the traditional chemo or radiotherapy treatment, yeah, I mean, to improve the chances of doing well, I believe that with good supplementation and nutrition, you can even go further and do better. Yeah. Okay, it all started end of 2023 when I did a health screening. And from the health screening, I noticed that there was a microscopic amount of blood in my urine. So from there onwards, then I went to see the urologist. And urologist did a ultra scan on my kidney and found that there was actually a tumor on the right side of my kidney. Yeah, so that has to be operated and taken out. So that's what I did. So after they remove it, they did a biopsy of it, and it's confirmed to be cancer. Initially, when I did the ultrasound, the urologist told me that the size, based on the size of my cancer and where it is located, it's likely to be stage 1. But when I did the surgery, the surgeon actually took a much longer time at the operating theater to actually get it done, because he realized that there's some other parts that actually got kind of have infected in a sense, and he took out the other parts as well. And he told me later on after my surgery that the cancer actually broke through the fat cell. Yeah, something like that. And told me that now I'm actually in stage 3.
Is there any thought that came to you at that time that say, okay, let's see if there's any other way without the surgery?
At that time, no.
No, you're comfortable for going for the surgery.
Yeah, because in my mind, I thought that if it were to be cancerous, the best thing is to take it out. I mean, that's what the urologist suggested it.
And there's the same urologist that did the surgery as well?
Yes.
Then after the surgery, then what happened?
After the surgery, when a tumor was taken out and it was confirmed to be cancerous, so from there onwards, then I went to see an oncologist for follow-up. And then the oncologist told me that my kind of kidney cancer is quite rare. It's not very common. So, and he told me that in terms of traditional treatments like chemotherapy or radiotherapy, there isn't any that would be effective against my kind of cancer. Yeah, so he told me that it's best that I just monitor on an annual basis to see if there's any cancer coming back.
All right.
Yeah.
Besides that, he didn't advise you anything else like some nutrition or something like that?
Oh, in fact, I asked him, is there anything that I shouldn't be eating? And he told me that you can eat anything. Yeah.
All right. After that?
After that, then I thought that I should do my own research because in the event that there are any cancerous cell in my body still, or that it's going to come back, I need to do something preventive.
Okay.
So that's what I did. I mean, I did some research to find out if there's any other way I can actually boost my immunity or to improve my chances of being in remission as long as I can. How did I end up here was, because the first oncologist that I saw, he told me that there's nothing that you can do, just monitor.
Yes.
So I didn't want to just be passive and just sit back.
Yes.
I know that cancer is not something to joke around.
Yes.
So that's where I actually decided to look for alternative sources of treatment.
Okay.
To boost my immunity and to actually improve my health.
Okay.
So that's where I come across Dr. Lee in KL.
Okay.
Yeah.
Okay.
To actually help me do this.
Did you find anybody besides Heal Within that you?
I think there are a couple others, right? I think in KL probably.
All right.
But I think Heal Within was because I look at the website, it makes sense.
Yes.
And I saw some of the videos and stage 4 patients, doing quite well. So I thought, give it a try.
Yeah. Okay.
Yeah. Personally, I believe in holistic treatment rather than treatment through drugs and the traditional form of treatment for cancer.
Okay.
Because I've got experience of past loved ones which didn't work out well when they went through the traditional route of cancer treatment.
Right.
So for my case, because the oncologist he himself told me that there is no other way, for my treatment, just to monitor. Yeah. So it only makes natural sense for me to look up for holistic treatment rather than just sit back and do nothing.
Yes.
Yeah, I mean, I wasn't hesitant at all because I was doing research on my own. What are the ways to actually tackle cancer?
Okay.
And I came across a lot of successful incidents of people doing well through alternative form of cancer treatments like metabolic treatments. Okay. Treating cancer as a metabolic disease and through nutrition and detoxification.
Yes, okay.
So that's why I thought that this is something that I should try out.
Yes.
Yeah.
Okay.
Mostly got to do with tackling the root cause.
Yes.
So that's through nutritional supplementation, detoxification, removal of heavy metals and plastics and things that actually disrupt your body.
Yes.
And from there on, a couple of other therapies to actually destroy and kill the cancer cells if there's any in the body.
Okay.
Initially was just the nutritional supplementation.
Okay. He started you with the nutrition first?
Yeah, nutrition first.
Okay.
That's for a couple of weeks. Then after that, the rest of the treatments came along. Things like 𝗲𝗡𝗏 therapy, PMF therapy. There's IV nutritional, the drips that you do, the IV. Yes. And then there is, what else is there? There is the hypothermal therapy as well, and chemotherapy as well.
Autohemotherapy, yes.
That one, let me see what else is there. Of course, there's also rectal therapy as well. A couple of injections of macrophages, chelation to remove the heavy metal. Some pre and probiotics that he gave me, and of course, something to drink to cleanse the intestines and the gut. So in the IV package, I think there are a couple of other vitamin concoction inside.
Okay,
that actually will help.
Okay,
with killing the cancer cells. So a lot of tests were done. Tests of heavy metals and plastics in my body. Tests of course, blood tests, all the various biomarkers in my blood.
Okay.
Yeah, so all these were done in order to find out what is missing and what needs to be balanced out.
All right.
And supplemented.
Okay, okay, all right. You did the fire infrared.
Yeah, fire infrared sauna. Please to help you to sweat out all the toxins that is accumulated in your body.
Okay.
So by doing all the chelation and then you sweat it out later on, you kind of sweat out the toxins more effectively.
Yes,
through the fire infrared.
Yes, it also helps to activate your immune cells also.
Yeah.
And then enhance your metabolism.
Yeah, that's where the red light comes in, fire infrared. Yeah.
Yes, okay, yeah.
Yeah, hypothermia is just basically just raising the temperature body, core temperature, so that I think it activates the white cells to kind of eat up any cancer cells that might be present in the body.
Right.
I think that's what it does.
Okay. Your diet. What are the changes made in your diet?
Changes, now I'm more aware of my diet.
Yeah.
In terms of eating clean and eating more whole foods.
Okay.
Cutting down on carbs and sugar.
Okay.
More vegetables.
Yeah.
And yeah, basically eat as natural as possible.
Okay. Any specifically changes in the oils that you use?
Yeah, I mean, I've been consuming a lot of MCT oil and omega-3 oil.
Okay.
Yeah.
All right.
More than I thought would be necessary.
Okay.
Yeah, PMF. Basically, what it does is it sends some kind of magnetic field through your body, and it I think it charges the cells.
Okay.
Yeah.
All right. Okay.
Energy levels, there is an improvement, but I wouldn't say it's significant.
Okay.
I think it's because due to also I need to sleep better, improve in terms of my sleeping performance.
Okay.
That has to be worked on.
All right.
Yeah. So it's still work in progress. I think my blood pressure has improved.
Okay.
Other than that, I feel healthy.
Okay.
Even that heart palpitations that I used to have has already reduced by quite significantly.
Okay.
Yeah, I had issues of gum bleeding. I will wake up every morning and find that my pillow is stained with a bit of blood.
Okay.
And even when I'm brushing my teeth,
okay.
there's blood. So Dr. Lee recommended me to try to do oil pulling. So that's what I do, oil pulling.
Okay.
And that seems to help.
Okay.
Didn't totally eradicate the gum bleeding, but I think it helped by at least 70%.
All right. Okay. Yeah. Okay. You had some chest discomfort?
Yeah, that was the heart palpitations together with chest discomfort. That one has gone down quite a bit already.
All right. Okay.
Reduced. Back pain, yeah. So from the back pain, I think Dr. Lee recommended me to do some squats, hand swing squats movement.
Okay.
On a regular basis. So that I believe helped strengthen my core muscles.
Okay.
And I think that actually also reduced the back pain.
All right. Okay. Okay. Doctor wants you to highlight this. He's saying you were like super compliant, like 100%. You didn't spare any efforts. Whatever you were instructed, everything in the prescription, like no compromising. Just give it all. So what made you do that?
Yeah, like I said before, if this is what the doctor has recommended me to do, for it to be most effective, then I'll do it because the risk is high if I don't. Okay. Yeah, and I believe that that the disease can be overcome through supplementation and detoxification. This is something that I believe on my own, even before I came to see Dr. Lee.
Yes.
So that's what I think is the best choice to make at this point in time.
Got it.
Yeah.
Got it. Okay. Did you ever have a thought, okay, instead of getting the vitamin C from 𝗘𝗚𝗏, if I'm getting a cheaper price in Singapore, why not replace 𝗘𝗚𝗏 in Singapore? Do you ever have a thought like that?
Yeah, of course. Okay. Because you always think that you can find it cheaper somewhere else.
Yes. What made you stick with the 𝗘𝗚𝗏 then?
Yeah, because I think it's best if I take from him within, because then Dr. Lee would actually know what are the exact supplements that I'm taking. If I'm taking from him, then it will actually reduce the chances that I'm not taking the right supplements.
Yes, exactly.
So that makes the most sense to me.
Yeah. So maybe there's some subtle details that he would know of. He can monitor.
Yeah, exactly. Because he knows his own supplements.
Yes, exactly. Okay.
Well, I mean, at this point in my life, I think health is the number one thing that should be in my mind. Without health, we have nothing, right?
Yep.
So what's the point of having so many other things, but if you lose your health, then there's nothing for you to even be talking about.
Precisely.
So for my case, I mean, I'm a cancer patient, so I take that very seriously. Because like I said, I've lost loved ones before, so I can't afford to have the same thing happen to me.
Yeah.
So regardless of cost, you got to give it a shot.
Yeah.
Yeah. I guess there's a lot. I mean, when it comes to health, diet and lifestyle is critical, I suppose, in terms of what you eat. Cutting on processed food is good. Eating more whole foods, exercising, and of course, you got to love yourself in terms of taking care of your health, your body. And of course, even and all these supplements that I'm taking, you try to understand what does each kind of vitamin do to your body, how does it help? Even things like vitamin D is critical. When I did my annual health screening, when I found out that I had a microscopic amount of blood in my urine, the report also showed I got very low vitamin D. So I realized that also, I've been also researching that low vitamin D is critical for cancer patients.
Okay.
So things like that, what certain vitamin does and lacking of it will actually result in certain disease. So a lot of learning points from throughout this health journey. Yeah.
Right. Okay.
So all this, if I had known before, then it would have helped me a lot.
Okay.
Yeah. You want to be holistic in terms of your diet, supplementation, and meeting your body's nutritional needs. I think that's important to prevent any disease in the first place.
Yeah.
With sufficient sleep and exercise, I think you can go a long way. The other camp would be, just learn from the first camp. Try to reduce your consumption of any ultra-processed food if possible, and eat healthy, and give your body a chance to repair itself. If you can supply the body with the right source of nutrition and raw materials, it's likely that your body will actually heal itself and take care of itself. If a patient still wants to go through the traditional chemo or radiotherapy treatment, to improve the chances of doing well, I believe that with good supplementation and nutrition, you can even go further and do better. Yeah, if you incorporate some sort of holistic treatment like supplementation and detoxification, I think you can go further together even with your traditional form of treatment.
All right.
Yeah.
Okay.
I never believed in chemo and all that. Even for my dad, also he had stomach cancer. He had stomach cancer, and then he got his stomach removed.
Oh.
Then everything was clear. Scan everything good. 1 year it was clear.
Yeah.
Then suddenly overnight stage 4. You see, it doesn't work. It doesn't work. The whole body's immunity is just stripped when you do chemo and all that. It may work for the initial stage, but when the cancer comes back, it comes back hard on you. Because your defense is already down. And it just comes back and just kills you. So I was glad when the oncologist told me that, there's nothing for you. And I said, well, good. I'll go look for something else,
Yes,
because I know that it's not going to work.
Correct.
There's many cases that it doesn't work.
Yes.
And yet in the traditional hospital, they are still spending tons of money asking you to go for chemo, radio, immunology, this and that. And it just weakens and kills the person slowly.
Yes.
You get what I mean?
Yes, exactly.
So I don't believe in that. I
Yeah.
don't believe that. If you tell me that this particular chemo has high success rate, okay, maybe I'll consider doing it.
Yes.
But the chance is like, they can't guarantee you anything.
Yes, exactly.
Yeah. If
Exactly.
you tell me that you do this chemo and then, the chances that you'll be in remission, it's going to be 80%, 90%.
Yes.
I'll go and do it.
Yes.
But the thing is that it doesn't. It doesn't.
Exactly.
It doesn't work like that. And I've been researching during my time also on cancer being a metabolic disease rather than a genetic disease.
Yes.
So 90% of the time, 10% is probably a genetic disease.
Yes.
But most people who got cancer is because of metabolic disease.
Yes.
So we have to tackle it from the metabolic route.
Yes.
This guy, Thomas Seyfried,
Uh-huh.
he did a lot of good work on metabolic disease. That's how I learned about it. a lot of people, cancer patients, stage 4, they got very good success rate through practicing this metabolic disease treatment. So basically, it's just reducing, because they want to starve the cancer cells. Where does the cancer cells get its energy from? So that it will multiply. It's basically from glucose and another thing called glutamine. And then, so if you cut these two, you will starve the cancer and you will just die automatically. And even fasting itself, simple thing like fasting. You know, your body will automatically cleanse itself and they will just eat up the cancer cells. So all these are, it's just what the body is designed to do. I mean, if you give it the correct stuff to do its job, it will just, disease will just disappear. I mean, you go and add in foreign things like drugs and surgery and all this stuff. It's just, you're just cleaning the surface, you know. You're not fixing the problem.
The root of the problem.
Yeah, so I've never believed in all this. Yeah, that's why I wanted to do something like that with a doctor, but Singapore don't have this. Singapore is all the traditional kind of. We have a mega cancer center, you know, huge one, new one, more and more cancer buildings, and there's hardly any integrative holistic doctors in Singapore. So I got to find one that's nearest to Singapore, like come over here.